Welcome, future nurses. Today, we're diving into a high-yield review of pediatric neurologic disorders. We're going to pull all the key concepts you need straight from your ATI materials to get you prepped and feeling confident for that proctored exam. So, here's our game plan. We're going to follow a logical path, just like you would on the floor. We'll start with spotting those critical red flags in your assessment, then move into diagnosis and crisis management, and we'll wrap it all up with the medications and family education that are so important. All right, first up, your initial assessment. This is where your sharp observation skills can literally make all the difference. We're going to focus on recognizing those signs that just scream, hey, we've got a neurologic problem here in your pediatric patient. Okay, picture this. You walk into the room, and this is what you see. A kid with a headache who's irritable and has been vomiting. These symptoms are your cue to start digging deeper. Your assessment skills right now are everything, because you've got to catch those early, sometimes really subtle signs of a developing neurologic crisis, especially increased intracranial pressure. Now, this is super important and a huge testing point. How a child's age completely changes the way increased ICP looks. For infants, the little ones, you're looking for physical things you can see or hear, those bulging fontanelles, that classic unmistakable high-pitched cry. But in older children, the signs are more about what they tell you. My head hurts, I feel sick, or maybe they're having blurry vision. Knowing this difference is absolutely key. And here we have a perfect example of a key physical exam finding for meningitis. This is a positive Koenig sign. You see that resistance and pain when you try to straighten the leg? That's it. And remember its partner, Brzezinski sign. That's when you flex the child's neck and their hips and knees automatically flex up. If you see these signs, your alarm bells for meningitis should be ringing loud and clear. Okay, so you've done your assessment, you've spotted the red flags. What's next? Well, now it's time to confirm what's going on with some diagnostic testing. This table is pure gold for your exam prep. For a lumbar puncture, your main job is all about position and comfort, getting the child positioned just right and making sure that topical anesthetic has had time to work. For an EEG, it's all about the prep, maybe keeping the child sleep-deprived, definitely no caffeine, and making sure their hair is clean. And for CTs or MRIs, your role is often about helping with that positioning and managing sedation to get a good, clear picture. The diagnosis is in, and oh no, your patient is now in an acute crisis. Let's switch gears and focus on what you need to do immediately, the life-saving priorities during a seizure. During a seizure, I want you to remember two words: safety, airway. That is your mantra. Your first moves are to protect the kid from getting hurt and to get them on their side to keep that airway open. But just as important is what you don't do, and I mean it. You never, ever restrain them, and you never put anything in their mouth, period. Okay, the seizure is over. We're now in what's called the post-ictal phase. That's just the recovery time right after. Your focus now is all about recovery and assessment. Keeping them in that sideline position is still number one to prevent aspiration. Then you're on to checking vitals, doing your neurochecks, and just being a calm, reassuring presence, because they're probably going to be pretty confused. And this is what we're talking about. This image shows that perfect post-ictal position. It's a simple, fundamental nursing skill, but it is absolutely life-saving. You have to know this. Okay, deep breath. The immediate crisis is over. Now our focus shifts to the long game, using medications and specific nursing interventions to get our patient stable and prevent this from happening again. When we're talking about long-term seizure management, your role as an educator is huge. You have to stress to families that taking these meds every single day is non-negotiable. Stopping them suddenly can trigger a really bad seizure. You'll also need to talk about checking blood levels, side effects, and really important interactions, like the one with oral contraceptives. And of course, making sure they have a medical alert bracelet. Now, let's switch gears to head injuries. If you've got serious swelling in the brain, that's cerebral edema, you need to get that fluid out, and fast. That's where mannitol comes in. It's an osmotic diuretic. Think of it like a powerful magnet for water, pulling that dangerous fluid out of the brain tissue. This is a critical, life-saving intervention to prevent something catastrophic like brainstem herniation. And it's not just about the meds. The little things you do as a nurse are actually huge for managing ICP. Keeping the head of the bed up just 30 degrees, making sure their head is straight, not tilted, keeping the room quiet and calm. Every single one of these actions helps prevent more pressure from building up inside the skull. They seem small, but they are so powerful. All right, we are on the home stretch. And honestly, this might be one of the most important parts of your job, because it's not just about what you do in the hospital, right? It's about empowering that family with everything they need to provide safe care once they get home. This slide right here is your must-teach list for any family of a child with seizures. You have to give them a very clear, no gray area list of when to call 911. A seizure that goes on for more than 5 minutes? Call. The child stops breathing? Call. If it happens in the water? Call. If it's their very first seizure? You definitely call. And remember, this whole education piece isn't just for acute problems. Think about chronic conditions too. For a child with Down syndrome, for example, your teaching is all about that proactive day-to-day care, helping families manage feeding challenges, the importance of good skincare, and being on the lookout for signs of infection. Okay, to wrap this all up, let's end with a critical thinking question. So much of safe nursing is knowing what not to do. So, what's a key contraindication in a patient with a basilar skull fracture? The answer, nasal suctioning. And why? Because with that type of fracture, you risk introducing bacteria or even the catheter itself directly into the brain. Remembering these key contraindications, that is what's essential for safe practice, and it's what's going to help you crush this exam.